Good morning. I want to first start with why we initiated this investigation. A few years ago, we looked at one-star nursing homes, which are the worst ones, and found a group of them were perpetually one-star, never improving for years, despite receiving millions in Medicaid funds. Our question was why? We started with South Jersey Extended Care in Bridgeton because it was the worst-rated nursing home in the state of New Jersey based on federal standards year after year. We followed the money. We looked at bank records and financial records for a 5-year period to see where the money went and who benefited. We conducted sworn interviews of key people. And what we found was that Stephen Krausman and Michael Koenig, who were in charge of the nursing home, and Mark Weiss, who was the owner on paper, constructed a long-running scam designed to maximize profits and minimize accountability. Here's how the scam worked. Krausman and Koenig found a straw man, Weiss, who was willing to play the part of owner in 3 nursing homes. He paid nothing for the businesses. They were given to him. Koenig had owned them in the late 1990s, but Weiss took over shortly after Koenig was barred from owning nursing homes in Massachusetts and Connecticut due to poor quality. Weiss didn't know anything about nursing homes. He was a figurehead who told us in a sworn interview he had absolutely no involvement in the nursing home, that he relied totally on Krausman and Koenig. And according to him, that made them good money and nice money over the years, which it turns out was the understatement of this investigation. Installing a straw man was an effort by Krausman and Koenig at misdirection. It was a sleight of hand. Look over here. So regulators wouldn't know what Krausman and Koenig were up to. Meanwhile, Krausman and Koenig were in complete control of the place. They controlled the books. They hired and fired staff. They decided where the money went. They themselves told us in sworn interviews that they handled everything. And for almost every major contract, they hired their own businesses. South Jersey Extended Care received $35 million in Medicaid funding, and they sent over $38 million to their own businesses in a 5-year period. They were owner and vendor, seller and buyer, vendor and customer. But because they had installed Weiss as the straw owner for decades, they had plausible deniability. This was the cornerstone of the scam. They pretended to be independent third parties who had entered into arm's-length transactions. But in reality, the nursing home and all of their related entities were operated as a single entity. And they worked like a family because they actually were family. Weiss was Koenig's cousin. Koenig and Krausman were brothers-in-law. Koenig's son worked for Krausman, and so forth. That was the setup for their scam. Straw owner, falsely pretending they weren't in control, keep it close in the family, inflate costs while extracting profits, and provide poor quality care. They exploited the poor, the sick, the elderly, people with disabilities, people with addictions, and residents who have no family to look after them. They profited on the despair of people who wanted better care but had no way to get it. And the money flowed in. Krausman and Koenig overcharged and underdelivered. They charged South Jersey Extended Care over $10 million for staff, like nurses, in 2 years. We found that they were short-staffed 75 out of 75 days we looked at, on average by 50% below state minimums every one of the 75 days. They maximized profit by short staffing and using unqualified staff. The director of nursing wasn't a registered nurse. The social worker, when there was one, wasn't actually a social worker. Temporary nursing assistants, some of them didn't meet the modest qualifications required of them. They inflated their costs for food. They made a lot of money through a medical supply business. Koenig's company got $6 million for consulting and management fees. Another $800,000 went to a religious charity controlled by Koenig, but just $3.6 million was spent on supplies. They spent more on consulting about the supplies than they did on the supplies. They also profited from renting nursing home properties to themselves. Krausman paid his property companies nearly $50 million in 4 years on behalf of the 5 nursing homes he managed, and then recently sold the 5 nursing homes for nearly $100 million. At the same time that Krausman and Koenig were generating enormous profits for their businesses, around $45 million during the 5 years we looked at. While they made a fortune, they were financially dismantling South Jersey Extended Care and risking closure. And this is very important to state. Krausman and Koenig were the operators and managers of not just South Jersey Extended Care, but also 9 other nursing homes all around the state. These include many of the worst nursing homes in New Jersey. And so in our report, we lay bare in great detail how it is that we spend so much money on nursing homes in New Jersey, and yet some of them continue to provide such poor quality care year after year after year. There are a lot of lessons here. First, as a state, we have to do a much better job of vetting owners, cutting through intentionally opaque ownership structures, and understanding who is really making the decisions for the nursing home, and whether they are making decisions in the best interests of residents or on behalf of themselves to inflate their own profit margins. We give them a lot of money. We should know who they are and whether we can trust them. Second, we can do this in part by better tracking the funds in nursing homes. We've shown in this report how profiteering in nursing homes works. We need to make sure our funds are being spent on good nursing homes for quality care. Third, as we get ready to enter the budget season, the legislature and the governor should be aware that much of the additional money going into the budget every year for nursing homes is going into Krausman and Koenig's and others' pockets. Reforms, including greater transparency and oversight, and what we suggest in this report should be in place before nursing homes get any more money. Fourth, we need a response that meets the moment, given what appears to be a very substantial amount of fraud, waste, and abuse that is leading to poor quality care. We have a duty to protect vulnerable residents of nursing homes in New Jersey, and we have a duty to protect taxpayer funds. We need to do a better job of fulfilling these duties. Our investigation is ongoing, but with the evidence we have collected so far, we have determined that the Medicaid program and the residents of multiple nursing homes must be protected from Krausman, Koenig, and Weiss. I am therefore announcing that we are suspending Stephen Krausman, Michael Koenig, and Mark Weiss and their companies and associates from the Medicaid program. With the approval of Attorney General Matthew Platkin, who is responsible for ensuring suspensions are consistent with the law and in the best interests of the state, we have sent notices to Krausman, Koenig, and others advising them that in 60 days, Medicaid funding will be cut off and they will be prohibited from being directly or indirectly involved with Medicaid recipients and Medicaid funding. We expect our suspension will impact 2 nursing homes, South Jersey Extended Care and Sterling Manor in Maple Shade, Burlington County. And we are coordinating with the Department of Health and the Department of Human Services to ensure that the care of the residents is the state's primary concern. We have also shared what we found in our investigation with others in government so they too can respond.